As we approach World AIDS Day, CNBC Africa joins Roche Life Talks and Red to put the spotlight on enhancing access to healthcare and building awareness of the importance of diagnostics as central to strong healthcare systems and in fighting pandemics. Hello and a warm welcome to this live broadcast and virtual webinar. I'm Kukuletu Mfupi. Now, the theme for today's discussion is certainly centered around a shared mission to end HIV and AIDS, the value of diagnostics in fighting pandemics, including that of the COVID-19 pandemic. We'll also have a look at the role of investments through public and private partnership programs in driving sustainable access to reliable and quality testing. Now, there's no doubt that we're certainly quite excited for today's conversation. We will hear from industry experts on key themes and outcomes that we should be aligning on and ensuring that we do see positive outcomes to effective diagnostics and how best we can beat and rise to the challenge of ongoing pandemics like HIV and AIDS and the current COVID-19 threat. But for the moment, allow me to introduce the panelists for today's discussion.
And the panelists are Dr. Ida Mbithia, Medical and Scientific Affairs Lead SSA at Roche Diagnostics; Connie Mudenda, Red Ambassador and AIDS Activist; Professor Akanu Alani Suleiman, Professor of Hematology and Transfusion Medicine at the College of Medicine of the University of Lagos; Jennifer Lotito, President and COO, Red.
Well, quite excited to see all our panelists who will be joining us here today, and also appreciative of the fact that we've taken out time out of your diaries to really reflect on what remains a very critical issue, not only for the African continent, but really the world over. And in light of the ongoing news flow and dynamics regarding the COVID-19 pandemic, it is quite important for us to still be mindful of not only fighting the pandemic that's at hand at the moment, but also ensuring that we maintain the focus on improving the livelihoods of those who are affected and infected by HIV and AIDS as we head towards World AIDS Day. So again, my gratitude to all our panelists who will be sharing their different areas of expertise, from health sciences, fully understanding the power of diagnostics, how best it is that we enhance on collaborative efforts, and of course fully unpacking and understanding the impact on individuals who are infected by HIV and AIDS. Well, to help set the theme and the tone for this particular conversation, perhaps it is quite best that we start with a very clear understanding of the role, function, and importance of diagnostics in the fight against pandemics. And perhaps I'd like to address this first question to both Dr. Ida as well as Professor Akanwu to help us further elaborate and fully get a better context of understanding the critical role that diagnostics does form in ensuring that we are able to rise and meet the challenge of the ongoing pandemics that we face. Professor Akanwu, perhaps we can start with you as you open up our session for us today, primarily focusing on the importance of diagnostics to help fight and curb pandemics.
Thank you very much. I'm happy to be here. We can start by saying that if there's no diagnosis, there can be no therapeutic intervention or any intervention whatsoever, not just the ongoing pandemic, but other epidemics that emerge some other time. And the clinicians or the physicians have put it very aptly when they say that a reliable laboratory test result is very key in accurate diagnosis of disease condition and for the purposes of implementing an appropriate medical intervention. You don't have a correct diagnosis, you cannot intervene, and there's little you can do to help the situation, the patient or the pandemic. We can take a vivid example and see how correct the physicians are. Somebody is presenting with fever. That fever will be an infectious fever could be a non-infectious fever. If it is non-infectious, is this a malignant fever or is this a drug fever? If it is an infectious fever, are you dealing with bacterial infection? Are you dealing with fungal infection? Are you dealing with viral infection? Are you dealing with protozoal infection? And you can continue to expand and expand that way. If you say this is a fungal infection, okay, what type of fungal infection it is? If you say it's a bacterial, what type of bacteria? Is it a chronic or an acute bacterial infection? This is where the laboratory comes in. The laboratory is at the heart of medical interventions today. So be it viral, be it fungal, be it protozoa, you really need the laboratory to help you to give exactly what is going on. With respect to the pandemic that we're dealing with, if Wuhan in China was not effectively equipped to be able to do appropriate genomics that identify the SARS-CoV-2 virus, we probably will not be talking about SARS-CoV-2 virus, and we just be dying of a disease that we don't know anything about. So the laboratory is there to help us identify what the pathogen is, to help us study the structure of the pathogen, to help us study the genomic of the pathogen. And the more our knowledge of the structure and the genomic of the pathogen, the more our armamentarium that we can actually deploy to fight the infection. So if we want to move ahead, and we are talking about some other interests, some other priorities, and we do not prioritize the laboratory, we won't get it right.
Yep. Very important elements that you mentioned there, and perhaps Dr. Ida, I can bring you in here, certainly serving within your role and capacity as the medical and scientific lead at Roche Diagnostics. This has certainly been your bread and butter for the last year at least, highlighting the ongoing need and importance and the value of diagnostics to ensure that we are able to adequately address the needs and challenges of major pandemics. Take us into your confidence here and building up on the themes that have been highlighted by Professor Akanmu regarding the value that can be unlocked by having the proper diagnostics infrastructure, and of course the importance to constantly have this kind of infrastructure evolve. Dr. Ida?
So thank you so much. And first off, it's an absolute honor to be part of this panel. And I cannot understate the value that diagnostics play when it comes to fighting pandemics, and specifically HIV and also COVID. And I will just start by saying that an important point to note is that when managing any disease, prevention is key, but absolutely important is also being able to detect the disease early. As has been mentioned by Prof. Akanmu, when it came to COVID, countries that had robust digital, diagnostic, and also healthcare infrastructure that was well developed were certainly better placed when it comes to managing the disease. So let's look at it from the HIV perspective. Anyone who's exposed to the disease should definitely get tested immediately. And what this means is that this individual is able to sit down with their doctor, come up with a treatment plan that ensures that the disease is kept at bay. And this means that they do not develop complications from the disease. It's also an opportunity to raise awareness in terms of potential high-risk behaviors that they should avoid, because this means that they now do not transmit the disease from one person to another. So when it comes to managing diseases, ensuring that we prevent transmission from one person to another is definitely very important. And this is where diagnostics come together to play an absolutely central role.
Dr. Ida, I'd like to keep with you as you focus on the central role that diagnostics certainly play. Help us fully grasp and understand the context of Roche Diagnostics, especially in the last year and even in the recent weekend events, where we've witnessed how diagnostics have proven to be quite critical in even assisting with the fight against the COVID-19 pandemic and early detection, early identification of new infections in the system that might remain. But from a Roche Diagnostics point of view, what has the last year and the journey been like in making sure that you're not only addressing the concerns regarding HIV and AIDS, but even for the COVID-19 pandemic?
So the last year has been an interesting part whereby Roche Diagnostics has been able to come to the forefront specifically to address the COVID-19 pandemic, which really has been devastating globally and also here in Africa. So what Roche Diagnostics has been able to do is to work closely with RED when it comes to raising awareness in terms of the importance of diagnostics when it comes to managing pandemics. And as you've rightly said, COVID is one of them, but HIV is also another pandemic that really has brought devastating consequences. So when we look at our journey as Roche Diagnostics, we have really been committed. And when we look at a pandemic like HIV, since 1986, Roche has been at the forefront when it comes to the fight against HIV. So we have really definitely played an important role. And what's important is that we have the social responsibility when it comes to providing access, particularly in areas where this is limited. And this is looking at areas which are low to middle income countries. So coming back to your question in terms of the past year, we've had the COVID test, which is the SARS-CoV-2 test that has really been able to address the pandemic from a testing perspective. And how Roche has worked on this is through the Global Access Program, which allows then a scale-up of testing to ensure that this is availed to low to middle income countries, particularly Africa. So this is how Roche has worked really hard in the past year to address not just COVID, but then also ensure that we do not reverse the gains against other pandemics such as HIV, where we've done quite a bit. And if you look at what we've been able to do since 1995, where we had the first commercially available test for HIV, since then we've been able to come up with 8 generations of tests to ensure that we address mutations, because we've seen that the virus does mutate and thereafter cause potential harmful effects. The other thing that we've done is to work collaboratively with other partners, so RED, so to speak, Global Fund, and we continue to ensure that we deepen our commitment when it comes to working closely with our strategic partners, so that we build the diagnostic infrastructure in the sense that it's able then to effectively handle not just COVID, but also HIV.
Yeah, very important you mention that, because it is quite clear that we are facing a plethora of pandemics at the moment, and they all need to be adequately addressed and met in terms of the needs, and that comes with the support of diagnostics. You mentioned the constant partnership with RED, and Jennifer, it would be remiss of me here to keep you silent for even longer, given that you are a representative of RED, and can certainly elaborate even further on the ongoing partnerships that we witness between Roche Diagnostics together with RED. And maybe you can perhaps just elaborate a little bit further on the critical need for these kind of partnerships, and how, of course, it also does highlight the importance that we not only focus on the COVID-19 pandemic, but also extending our focus onto other illnesses like HIV and AIDS. Jennifer?
Absolutely. And thank you so much for having me. It is a pleasure to be here. So yeah, absolutely. And I completely agree with everything that the professor and Dr. Ida have already shared. I think when you think about where we are in the fight against HIV as well as COVID, I mean, really what RED is focused on is ensuring we're always driving relevance. Now, it's funny to talk about relevance, right? This is a disease, this is a virus. But for us, we've got to get people to be aware and to care. And I think that there's a little bit of a good news, bad news here, because the good news is, thanks to many of the people here on your panel and many others in the global health space, we've seen incredible progress in the battle against HIV. With progress, with success, unfortunately comes complacency. And that's what we've seen in the battle against HIV. And unfortunately, we are seeing that now already. I mean, as Dr. Ida mentioned, this goes back over 30 years in terms of the battle against HIV. We've been in the battle against COVID for nearly 2 years now. And what we're seeing is a little bit of that complacency as well. So we're so grateful to our partners at Roche, because what they've allowed us to do is to talk about the importance of diagnostics, the importance of getting out there, getting tested. That is the beginning of ending any sort of pandemic, is understanding getting a diagnosis, and that is exactly what Roche has been doing. So I think if you take a step back and you think about what RED is doing, I mean, RED is really here to bring companies in, to drive energy, to drive engagement. Unfortunately, with the arrival of COVID, we're seeing, as I was saying, this devastating effect on the progress we've made against the HIV epidemic. So it's really important that we continue to have these types of conversations. I think we can all agree COVID's sort of sucking the oxygen out of the room. Yeah. And the conversation has been so focused on COVID, but we cannot forget about the progress that we've been making on HIV. And certainly diagnostics is at the core of that. So I will say, you were asking Dr. Ida about the past 2 years. I think from a RED standpoint, our job is harder than ever. I think this has been a really tricky couple of years, but we have no plans of stopping. We are continuing to stay out there. We are engaging with incredible companies like Roche and others, but not only because this is absolutely the right thing to do, but because until everyone is safe, all of us are in danger. This has to be looked at through a global lens. It cannot be looked at in different, just by community. We must look at it broadly, and that is exactly what RED is aiming to do.
Very important that you mention that, because we do need to look at it as a global community. As you mentioned, it does appear as though COVID is sucking up all the oxygen in the room, and we witnessed that with recent headlines such as the discovery of the Omicron variant of this particular illness and of course disease. And this raises a key element that we do need to be cognizant of. And Prof, I'm hoping that we can get your feedback on this one here. If this focus, this streamlining of attention and prioritization of the COVID-19 pandemic and its multiple variants might take away and lead to a certain neglect of focus on other pandemics like HIV and AIDS. Does this present a potential threat? And if so, how best do we need to manage the dynamics of prioritizing all healthcare pandemics with equal attention?
COVID came 2020, and we saw what it has done to the medical world, particularly the HIV community. In fact, to the HIV community, to be specific, it has hit that community in 3 different ways. There are what we call HIV-associated programs. One big program in HIV medicine is what we call HTS program, HIV testing services. We don't carry out appropriate HIV testing services. We don't get new people to deliver antiviral therapy to. And the goal today is that everyone that is living with HIV must be detected and must be administered to antiviral drugs. And that is the goal that we think, if we achieve that, by the end of year 2030, from all projections that we have, we might be able to announce an end to the AIDS epidemic. But if you don't get those people that are living with the virus, how can we deliver effective antiviral therapy to them? The HTS services have been very negatively impacted by the COVID pandemic, in the sense that not just the lockdown, the fear that the social distancing, we don't want to come to the hospital, the fear of COVID is everywhere. People are no longer coming for HIV testing. That program that we call index testing, looking at somebody who's already infected to track another person that may be infected, that is a sex partner or has a relationship with that individual, has also been disrupted. The HTS services has been adversely affected by COVID. And we think that's going to be a major problem. A major problem in the sense that people will be living with this virus, they will not come to detection early. And that's a big, big problem. The other problem that we have seen is that COVID has negatively impacted what we call antiretroviral therapy, because access to come to the clinic and access the drug was also negatively impacted. We try to see what we can do around that by actually couriering drugs to patients, but how many? Because we have thousands of patients that are actually supposed to be on antiviral drugs. We try to see whether we can actually move those commodities to the communities. How effective has that been? The problem we now have is that a number of patients have been without their drugs, and the implications of that is treatment failure. treatment failure has its own further implications in terms of what we call resistance evolution. That's a major problem. Then the last one point I'd like to make is what I prefer to call COVID stigmatization. A patient who works in accident and emergency department in the teaching hospital, and everybody is suspecting COVID. They neglect that individual because you don't want to contact COVID. You do not have the so-called protective personal equipment. You do not want to attend to that individual. An individual is coughing away, is having very bad chest pain, and you suspect it is COVID, whereas this individual has pulmonary embolism. You do not attend to pulmonary embolism, in the next one to that individual dies. COVID has negatively impacted. The other problem, you even have a number of pregnant women who are in labor and they are rushed to the hospital. You first of all want to see whether this individual has COVID infection or not. And it takes time. This is where the problem is. The laboratory is a major issue.
Yeah.
It takes time to get the COVID test result back to the clinic for the clinicians to act on it. As we speak, if you want to do a COVID test where I work, it still takes about 72 hours for you to get the result. And here is the patient lying before you. You say you are not going to touch that individual because you are afraid of SARS-CoV-2 infection. In fact, you are also making a differential diagnosis of SARS-CoV. Every disease now has a differential diagnosis of COVID. And that is a major problem. If the lab is there and properly equipped, and you can get your result in 2-3 hours, that would be fantastic. But that's not what we have today.
You mentioned such a critical point there, Prof, and I'm hoping then to get Dr. Ida perhaps to respond to this potential threat and a build-up to this question as to how do we resolve this, especially the theme of COVID stigmatization that Professor Akanmu has highlighted here. Dr. Ida, if it does come to expediting tests, expediting the rate of results, and goes back to the investment in diagnostics that we require, what are some of the solutions or the levers we need to be pulling at to ensure that we don't necessarily address these pandemics in isolation, but really do have a multi-pronged approach that is speedy, that is efficient, and most importantly, has the buy-in of all necessary stakeholders online? Dr. Ida?
So you raised an important point in terms of what we can do and bringing all the stakeholders together. If we look at the discussions that we're having today, we're looking at the role that different stakeholders then come to play to ensure that diagnostic testing is available. We're looking at what role do communities play? What role do non-governmental organizations play? What role does private organizations, for example, Roche play in terms of raising awareness from a diagnostic perspective? And a key way to be able to enable this is for people to be aware, about the diseases, for health education to be out there, not just for the healthcare professionals, but also for the patients themselves who are suffering from this disease. As the users or as the utilizers of the diagnostic services, they need to know that I do need to present to a healthcare facility for me to be able to get the help that I need. And just to add on to this is that I cannot overemphasize on the importance of partnerships and collaboration when it comes to ensuring that the diagnostic ecosystem is well supported. It is very broad, it is vast, because when you think about diagnostics, it's not just about doing the test itself, it's also about sample referral. How do the results come back to these patients? And so many other things in terms of waste management. So working together with other organizations then thus plays a key important role to ensure that everyone gets tested when they should. And the important thing to also underscore when it comes to testing is that patients can now use the information that they have about the disease to make better choices when it comes to supporting other family members and when it comes to supporting communities to ensure that diseases are really, really impacted in a positive front. So what I'd like to say is that we cannot underscore the importance of collaboration. We also cannot underscore the importance of awareness and health education. And we also cannot underscore the importance of fighting one pandemic, but also having another pandemic close at heart to ensure that we are moving forward, and that all the traction we've gained when it comes to diseases does not move back. So looking at the COVID pandemic, so to speak, in Africa, we've been able to gain some mileage because there was investment in the HIV diagnostic infrastructure in some countries, and they used these to quickly scale up COVID testing.
Yes.
So the lessons we learned from one pandemic can definitely be used to fight another pandemic.
Yeah. Dr. Ida, I find it quite important that you mentioned that, including the camaraderie, collaborative effort, and of course awareness that we certainly need to build up on. And this is where I'd like to bring Connie in. Connie, you are an ambassador as well as an AIDS activist who has been very vocal about your experience through managing this particular disease, and of course how it is that 2 particular tests actually changed your life. So giving us a practical example as to how it is that diagnostics actually influenced your life, and most importantly have also seen you pay closer attention to the importance of diagnostics and the impact it can have on the livelihoods of many individuals in society. So Connie, I'm delighted to have you on for this particular panel, and I'm hoping that you can perhaps reflect on your personal story to highlight and further elaborate on how the power of diagnostics shifted your life, but most importantly also speaks to how we as members of society need to play a proactive role in getting tested, seeking awareness, and actively participating with healthcare community workers. Connie?
Thank you. One thing I would really like to say is that it's very important to go for early diagnosis. I lost 3 children from HIV, and it took me a long time to make a decision to go for a test. And even when I went for the test, I did not go there voluntarily. I went there because my partner was very sick, and if I did not go for the test, he would have died. And thank God I did, because I was still healthy, I was not sick. And I went, I was found positive. And because I was okay, I did not need treatment there, but they were monitoring me by monitoring my viral load and monitoring my CD4 count, so that before I could fall sick, they can put me on treatment. And that took about 8 months from the time that I tested, and I was put on treatment on my birthday, on 13th of October, 2004. That's about 16 years ago. And because of starting treatment early, I had very little complications. I continued living a healthy life, even if I was positive. And even the people at the clinic continued taking good care of me. And later on in life, because after testing me and finding out that my viral load had really gone to undetectable levels, and my CD4 count was very high, having lost 3 children, my doctor suggested that maybe I should try to have another child. And I was told that, you know, right now with the new technology and the medicines that is on board, you are able to have a child that is negative. I was a little bit skeptical and a little bit scared, but having been in the system for some time and knowing that if you're taking your medicines religiously and faithfully, chances are that you cannot be able to pass on HIV either to your partner or to your child. And when I was found to be positive, when I was diagnosed and told that I'm HIV positive, I'd actually told myself that I will never pass on my HIV to any other person. Whatever HIV that I had was mine, and I'll keep it to myself. I'll not pass it on to a unborn child. I'll not pass it on to any other partner. So I was really very careful, even when I was making a decision that I would try to have another child. And I took all the necessary precautions, and I conceived in 2012. And towards the end of the year, on the 21st of November, 2012, I delivered a baby girl who went for a test also six weeks later, so that they can be able to check if she got the HIV from me or not. And I'm really proud to say that because of taking my medication faithfully, religiously, I managed to have a child that was negative. And I kept to my word because I'm looking at bringing up a generation that is HIV free. Whatever HIV that is there around should stay with us and not be passed on to the next generation. And I'm proud to say I have managed to do that on my part. Thank
Connie,
you.
I must say that that's quite a fulfilling story and encouraging, because you also are highlighting the fact that when we do play a proactive role in getting tested and detected early, when we do also take your treatment quite effectively and follow through with the insight, the lessons and the instructions of healthcare professionals, we are able to actually block or prevent further spreads of such pandemics. And I find it quite refreshing, because this is certainly quite a lesson that we do need to spread to many corners of the world, to show that through active camaraderie, active participation, we are able to actually beat the scourge of spreading certain illnesses. So we really commend you for that. But this also brings to the fore the importance of partnerships, right? Which we've been hearing about this morning. And perhaps, Jennifer, I'd like to come back to you here to expand on this, given that this is a collaborative effort between RED together with Roche Diagnostics. And I'm keen for us to fully unpack a few more details about this partnership. Not just, number one, to increase awareness around the importance of diagnostics, but also making sure that, again, we get society and communities buy-in to fully understand the importance of this 360 approach: testing, early detection, unpacking your results, and of course seeking the appropriate treatment as and when is necessary. But I guess take us to fully comprehend and understand the start of this partnership, which commenced, if I'm not mistaken, in 2020, and what further outcomes we are looking to see being established between RED as well as Roche Diagnostics. Perhaps after you're done, Jennifer, Dr. Ida can also come in to share some of her perspective there too.
Yeah, absolutely. And I think that 360 that you're talking about, I would actually even expand on it a little more. And I think this opportunity that we have now, the telling of this partnership. And so, yes, as you mentioned, it started in last year in 2020. RED and Roche came together. And as I talked about before, we've got to get this story out there. We've got to help people understand not just the sort of technological side of diagnostics, but the human side of diagnostics, which is what Connie's story helps to deliver so beautifully. And so this is really what we've been able to do is in this partnership is to be able to bring to life the impact of the diagnostics that Roche provides. And that for RED is, again, another opportunity for us to get our story out there. As we've been talking about today, with the onset of COVID, it's so important that we continue to talk about this, to continue to tell the story, bringing relevance. I know I mentioned that before, but this concept of global health emergencies, you know, there's these terms like global health emergencies, health system strengthening, all of these things. But at the end of the day, these are things that have a real impact on all of us. And so I think what we've been trying to do from a RED perspective is bring those stories to life in a compelling and relevant way and finding those stories. So whether it's the technology and the innovation of companies like Roche, or if it's the stories of Apple and the RED products that they sell, all of this together is having an impact. And from our perspective, this has been a really important thing to continue to get out there. And as you talked about, these are about collaborations. These are about working together towards a collective goal. And certainly from our perspective, the goal is to get these current pandemics under control and hope others in the future. And I just have to say, going back to the Roche and RED partnership, I mean, we've seen really great engagement. We're seeing people really understand the work and understanding these models. It's also helped, you know, from a business perspective, it's helped us because we're expanding our model. So it is, yes, there are the RED iPhones, which are incredible, but there are other ways that companies can participate. And I have to just give a little bit of a head nod point, because I think that they are already doing so much, and it would have been very easy for them to say, you know what, we are very focused on this, we're doing all of this work, but actually they're also stepping up and talking about it and working with Red and allowing us together to bring that story to life. And I think the multiplier effect that has on the Global Fund, which is the recipient of all Red money, and then at the end of the day, the frontline workers, people like Connie, our activists, these are the people that are bringing this all to life. So again, going back to where you started in that 360, for us, it is all the way to the frontline workers and the people that are on the ground like Connie that are doing this incredible work. And then certainly Labona, which is where it all comes, which is Connie's young daughter who was born HIV free. So to me, that's the culminating point of partnerships like this. But Dr. Ida, I guess I'll turn it over to you to add to that.
Yeah, thank you so much, Jennifer. And just to reiterate your point is that Roche and Reds are on a shared mission when it comes to ending the HIV pandemic. We have goals towards ending the global HIV pandemic in 2030. And it's actually the first time that Red is partnering with a diagnostics company. And just to allow us to see, I'd like to present statistics in the sense that we have 7.1 million people living with HIV and they do not know it. And then we have another 38 million of people with HIV and are living with the disease, but of these, only 59% are on treatment. So Roche and Red are partnering together when it comes to change the narrative in such situations. And again, I will say that we are working closely together to ensure that we raise awareness on the importance of diagnostic testing. And like I'd said before, and I'll continue to state, is that when you look at the diagnostic ecosystem, it's not just about providing access to tests. It's also looking at other tenets of the diagnostic ecosystem, which also play an important role to ensure that patients now have access to testing. As Connie said, when patients are able to get their tests in good time, then it gives them information as to how they manage their disease. Yeah, we see in such a case that we have children who are born HIV-free. And when we think about children being born HIV-free, it's about preventing the transmission of the virus from the mother to child. It's also ensuring that the virus is suppressed to a point whereby one cannot transmit it from themselves to any other person. And this is very, very key when it comes to fighting this pandemic, HIV, and also other pandemics. So a lot has been done, and there's still so much more that can be done, but we are definitely committed in the fight against the pandemics.
Yeah, we definitely are committed, and I think it's quite refreshing that we hear this constant messaging, which certainly highlights the fact that there's a concerted effort here. The goal and the objective is clear: eradicate some of these pandemics within some tangible targets, and most importantly, continue to solicit the buy-in of ongoing partners to provide the necessary support. And perhaps, Jennifer, this is where I'd like to come back to you. You've made it very clear that as a representative of Red, you've worked quite proactively with large brands, household names that many of us are quite familiar with, but we're well aware that businesses themselves have also taken a sense of strain in light of the pandemic, in light of the subsequent lockdowns, and perhaps our focus on which pandemic to fight first and how to offer support might have been shifted. I'm keen to get your clarity here, Jennifer, as to how it is that more businesses are actually playing a proactive role to play their part by providing the necessary resources and tools to ensure that that 360 approach that we highlighted earlier is something that can be fulfilled. So I guess, given that it's business unusual and business has been tough, is business still being proactive to come on board and assist in fighting these pandemics, particularly when it comes to HIV and AIDS, and not just primarily focusing on the COVID-19 pandemic?
Yeah, and that's where Red comes in, certainly, and that's our job. That is getting these companies to care. And I think that when you look at COVID, I think that the interesting thing is that businesses are continuing to thrive, are continuing to grow, and you know, the idea that we participate in any sort of global COVID response, I would say would be a bit short-sighted, because we are never going to get out of this pandemic if we don't invest in this global response. And so from a business sense, and even from a self-interest sense, it makes perfect sense to invest in this globally. And I think that when you look at it from a macro perspective, so you look at governments, and governments certainly have a role to play in this, but companies have a role to play. And I think it doesn't matter if you're, when it comes to governments, it doesn't matter what side of the aisle or what your politics are, there is a role for governments to play. But we also have seen recently in the past few years that people are looking to CEOs and companies to do the right thing, maybe even more so than governments. Right. So I think it's really important that companies are the ones stepping up. We were co-founded by a rock star. There's a lot of CEOs out there, I think, who are the rock stars of today. They're the ones who are making the case for things that are doing good. And it makes good sense. It makes good business sense for them because when we look at the devastating impact that COVID had on so many businesses, the idea of potentially a variant and another lockdown and all of these things and the impact that could have on their business, it would be crazy to not focus on it. So I think from a Red perspective, it's really important to always come up with new ways to engage companies, come up with new ways to engage their customers, certainly their employees. This is a sense of pride, I think, that companies are investing in doing the right thing here. So from a Red perspective, it puts the onus on us to be innovative and creative and come up with new ways, giving companies new reasons to participate. And I think whether that's HIV or COVID, these are both going to continue to thrive if we don't focus on both of them at the same time. So from our perspective, it is important for these companies to step up, more important than ever. And it's important for us to be coming up with ways in which they can do that that makes good business sense. That is certainly a continued focus for Red.
Oh, excited to hear that. And I think really does speak to the spirit of shared value, right? Where you prioritize all your stakeholder groups, and it still does translate into positive outcomes for shareholders and those who interact with the brands. But of course, even these initiatives like creating awareness for HIV and AIDS and this COVID-19 pandemic really do bring about some significant changes. And I really want us to peel back and perhaps add some excitement, because whilst we're concerned about the new variant of the COVID-19 strain, we're concerned about the lack of focus that we might have deviated from in our attention of fighting HIV and AIDS as we head up to World AIDS Day. I think it's important for us to also reflect on some of the past successes that we've also attained. And perhaps, Dr. Ida, this is where I'd like you to come in to tell us more about the Global Access Program. And I understand that this has been used as a case study, as a base, which has really led to some resounding outcomes, particularly when it comes to the focus of HIV and AIDS. But help us unpack how there could be some lessons we could draw here from the Global Access Fund to then use this as a stepping stone or a guide as to how best we should be approaching the COVID-19 pandemic. Dr. Ida?
Yeah, thank you for that. And we know that pandemics really cause a lot of devastation. And when it comes to quality infrastructure and medical innovation, this is a challenge globally. And so what a lot of organizations have done is to come together to see how they can bring to an end major diseases. So the Global Access Program was launched in 2014, and this was in a bid to address the UN AIDS 2020 targets. And since then, it has expanded considerably, not just in terms of scope, in terms of the tests that are offered, but also the geographical reach. And what this has meant is that patients can get access to important diagnostics because of affordable pricing in identified organizations, particularly in countries that are hardest hit. And what's important to note is that it's not just about providing affordable pricing to these diagnostic tests, but also strengthening the capacity when it comes to the diagnostic ecosystem, as well as building the capacity in terms of response to the disease. So from a scope perspective, the Global Access Program has also looked at diseases like TB, has also looked at diseases like hepatitis, has also looked at human papillomavirus, which leads to the development of cervical cancer. So because as a result of this focus with the Global Access Program, we see that we've been able to scale up testing from where we had 2 million tests done in 2014 and being able now to scale up to over 20 million tests by the end of 2020. So the Global Access Program has also played a very important role when it comes to a pandemic such as COVID-19, because what it has done is that it has provided affordable testing, particularly for low and middle income countries where really the pandemic has also had devastating consequences. And if it was not as a result of access, then testing would be a challenge. So I'd say that the Global Access Program has played an important role. And maybe just bringing it back to HIV, when we look at the UN goals of 95, 95, 95, what does this mean? It means that 95% of people are able to know their HIV status. And of those who know their HIV status, 95% then are able to be on treatment. And Connie has understated the importance of treatment.
Yeah.
And of those 95, then we have another 95% of these living with the disease that is suppressed. So what the Global Access Program has done is that it has addressed the 95, 95, 95 goal by ensuring that we are able to scale up testing from an early infant diagnostic tests perspective to also HIV screening tests, just to ensure that we are addressing the goals against the fight for HIV.
Very important you mentioned that, right? Getting that buy-in from many of the stakeholders. And perhaps a good point for me to bring Connie back into this conversation as we try to use some of these case studies, use some of these examples to certainly make sure that we are able to build up on the objectives that we'd like to set. And perhaps, Connie, I'm keen to get your buy-in here. As we are well aware, you've proven that early detection, early diagnosis, early treatment and sustainable treatment are certainly the solutions that need to be brought to the fore. I'm keen to get your thoughts here, Connie, as to how we expand on the community buy-in, especially in a world where, when it comes to the COVID-19 pandemic specifically, there's a lot of noise, there's a lot of changing and evolving news flow, and sometimes as community members we tend to push back because of a lack of understanding or a lack of clarity of some of these scientific terms that we're not too familiar with. But if you could, I guess, speak into the minds of communities across the African continent, Connie, what is it that you would say to make sure that communities are active participants in beating these pandemics?
All right. Yeah, I was saying that one thing that we have really relaxed on so much is community sensitization. One thing that we need to understand is that there is never too much sensitization that should go around. We have to talk and talk and talk. It doesn't matter whether we are repeating the same things, but believe you me, at the end of the day, there will be someone that is listening to what we are saying. Community sensitization is really key when we talk about the fight against HIV. There is a lot of conspiracy theories out there. There's a lot of myths. There's a lot of misconceptions, and people need to hear something that is reassuring. And believe you me, people in the community have trust in people from the hospital. They will listen to you when you go out there to speak. And we have really relaxed on that. And we need to go flat out and educate the masses. Like we used to do in the beginning, just when HIV came on board, just when we had free ARVs, we went out and we sensitized people, and people were coming to the clinic. We have not yet reached our comfort zone where we should sit down, relax, and take a cup of tea. No. This is a time that we need to stand up and work, especially right now where we have the COVID, because people's minds are now split. They are thinking about COVID and then they are thinking about HIV. COVID has come with a lot of issues. People have lost jobs. People have lost their houses. People are living on the streets. And when we talk about HIV, a lot of people are now lost to follow up because of COVID. They have lost their jobs, so they've been kicked out of their house. We do not even know where to find them. So all those issues need to be addressed if we need to get this thing back on track. We have lost a lot of ground when it comes to HIV from the time that COVID came on board, because people's attentions had shifted to COVID. And I believe a lot of people now think that HIV is a lesser evil when it comes to comparing HIV and COVID. But even as we are dealing with COVID, let us not forget HIV in the process.
Yep.
Let us continue sensitizing. Let us continue teaching. Let us continue whatever we used to do so that people should not be caught napping at the end of the day. People should remember that this is something that we need to do. Like for me, I should not stop taking my medication because maybe I am stressed because of COVID. I have to take this, I have to do that. I have to remember that even with COVID, I still am living with HIV, and I have to continue with my HIV lifestyle that I've put myself on. Even if I'm putting new things like the 5 golden rules on my list of to-do list, I still need to continue with what I used to do when it comes to HIV.
Yep.
So
certainly,
the most important thing here is education. And also, we should also look at involvement. HIV, COVID are not Africa's fight. They are not America's fight. They are not a Chinese fight. These two pandemics need everyone on board.
Yeah.
We need concerted efforts from everyone. We need to be in a position where we lift each other up when it comes to that.
Yep.
We are different continents, but we have the same pandemics.
Yes.
That we should not forget.
Oh, Connie, you mentioned a very important point there,
forget.
because I think it's quite critical that I jump in, especially in light of the most recent news flow that we're aware of this most recent variant of the COVID-19 pandemic, Omicron. And perhaps, Prof, I'd like to come to you here, because what is quite evident is that, as Connie has mentioned, it's a global pandemic, but we live in different continents where we need different solutions in order to mitigate the threat of these pandemics, whether it be HIV and AIDS or that of the COVID-19 pandemic. And I'm keen to get your thoughts here, Prof, as to what are some of the barriers to adequate diagnostic systems that we need on the African continent in order to ensure that the goals and targets that Dr. Ida mentioned to end HIV and AIDS as a pandemic, see a fruitful end to the COVID-19 pandemic and threat, is something that is tangible for us. So in other words, Prof, if you could lead us off in fully understanding what is required for us to remove further barriers to quality diagnostics to beat these pandemics that we're plagued with, specifically on the African continent. Prof?
Thank you very much. All the collaborations that are available are required. And I thank Ida and every other panelist that have been talking about collaboration and collaboration. But to end the pandemic specifically, you must go back to the lab. The nature of the pathogen is what we have to understand for us to be able to craft a mechanism of appropriate intervention that can help us to end the epidemic. And that nature of the pathogen belongs to the scientists, belongs to the lab. Lab is so critical. Very unfortunately, to your question as to what is happening in African countries' laboratory, whether we are prepared to support the effort towards ending HIV or COVID epidemics. I could say to a large extent, that may be true to a large extent in the sense that the coming of HIV to African countries as far back as 1987, even though the story started as far back as 1981. But I was talking about HIV epidemics, truly in most African countries, it's about 1987, 1989. That is when we realized that we have a real problem in our hands. And the role of the laboratory was a big problem at that time in the sense that we could not even diagnose. We really need to bring up laboratory scientists to be able to train them in what we call conventional ELISA techniques. It was to be able to train the laboratory scientists in what we call Sci-Flow, or yes, to be able to do C-alpha cell count, you need the knowledge of flow cytometry. These were the thinking in the early 80s, in the 1990s. But in the early 20s, where we now realize the significance of having to know the viral load level for us to be able to say we are doing effective treatment and we are assuring ourselves that our treatment is effective, effectiveness in the sense that the viral load becomes undetectable. The laboratory was not there to give that. And there was a need to have to invest in laboratory infrastructure again to be able to do viral load assays. And we must thank Roche because they took the lead at that time. The big equipment that we now have that we call Cobas and Takman, the 48, the 96, the 4800, 6800, 800 were not there at that time. What we were dealing with was Roche Amplicon version 1.5. But this was the basic tool that a laboratory scientist need to understand in what we call DNA PCR technique. And that technique, what that we have acquired was what's now available for us to be able to now be doing the so-called COVID DNA PCR testing. So we have acquired HIV has brought some knowledge to us. So a large extent, the African laboratories has acquired some expertise in handling this type of new epidemics. But I must quickly add that COVID overwhelmed all the infrastructures. Despite that, we have this basic understanding, but where are the laboratories and how many laboratories are available to actually help us to contain the menace of COVID when it came? So there's still need to have to invest more, expand the number of laboratories that are available, do more training for the laboratorians, and let us be able to do the appropriate testing at the right time. This is what we need for us to be able to say we'll be able to end the AIDS epidemic. Particularly, I thank Ida and Connie when they were alluding to the possibility of ending AIDS epidemic by the year 2030. That you can never be sure of until we are able to say the millions, 38 million that Ida quoted, that those 38 millions are virologically suppressed. Because it is only when you are virologically suppressed that you are incapable of transmitting that virus to unaffected partner. What we wanted to be able to say in 2030 is that there will be zero new HIV infection. And that will come only and only if we are able to ensure that everyone living with the virus is undetectable. And how do you ensure that? Laboratory must be properly equipped to be able to do 38 million tests in 1 year at least. And that is a huge investment. So we want to end an AIDS epidemic, bring all the collaboration to the board, but don't forget the laboratory. The laboratory has critical role to play.
Thank you so much. I appreciate that, Prof, as well as the passion that you've shared with us. It is the infrastructure, it is the investment in the skills and the technology and the laboratory, because that's essentially where we find out the various strains and, of course, what it is that we're dealing with when it comes to these particular epidemics and pandemics that we are plagued with. I think you've really hit it on the nail on the head that all collaborative efforts do need to come together. But as we do conclude, there's a comment that I'd like to read that has come through from our website, and it's from one of our guests who has joined us virtually, Batupe Mhango Chipanta, who says stories like Connie's are what the world needs more of to combat both HIV and COVID pandemics. I'm also HIV positive as a mom and have an HIV negative child, and I know the challenges and the stigma, the fear and the lack of knowledge that the public has. But we need to keep boosting these positive voices up, and people can't digest too much medical or technical jargon, but they will always remember the stories of mothers and wives and of Africa's young women and girls. I think that is such a pertinent element to leave this on, and perhaps close off with our last question to you, Dr. Ida. As we wrap everything up, we're well aware that we are approaching World AIDS Day for 2021, where the key theme is end inequalities, end AIDS, end pandemics. As we've heard from Prof as well as some of your fellow panelists, it continues to focus on the ongoing collaborative efforts that are required, the key investment in diagnostics, in building up and securing community involvement, and of course making sure that there's a 360 manner of participation in order to end all pandemics. But I'd like to close off with you, Dr. Ida, to ask you, as we move into World AIDS Day for 2021, how do we hope to make this year's mark different to the years ahead and the objectives that we've set for ourselves? In other words, what will it take for every stakeholder to come on board to make sure that the 2030 goals and objectives we've set for ourselves really do become a reality?
What it will take for each and every stakeholder is bold action. If we have no bold action, then we will not meet our goals. Whether it be the HIV pandemic or whether it be any other pandemic, we will not meet our goals. And what it requires is a transformative change in terms of how we address economic policies, social policies, and cultural policies that then address these inequalities. And the inequalities are wide in scope, but we definitely need to rope in on that. And one of the things is that there's a misconception that during a crisis, this is not the time to deal with social injustices. But I'm here to tell us that if we do not deal with the social injustices and inequality at this point, then we cannot get rid of the inequality and we cannot get rid of the pandemic. There has been a lot of needless death, and specifically for COVID as a result of delays from different governments and different healthcare systems. So to be able to address inequality, we definitely need to have bold action. And bold action means we change the way we are dealing with our social, economic, and political policies when it comes to addressing pandemics.
Indeed. Thank you so much to each and every one of you for sharing your insight with us here today. And I must say, very refreshing to hear that we are all aligned on the objectives to end these pandemics, to bring about a better outcome when it comes to healthcare services that are provided on the African continent, and primarily going back to a social cohesion and a social compact, having large corporates continue to assist in our fight and development of diagnostics, the same diagnostics that are required for the broader public to ensure that they actively participate in early detection and early testing, and of course the individuals and healthcare professionals who themselves continue to apply their minds to the technical abilities that are required in this ever-evolving world of healthcare pandemics that we shape. And of course, primarily making sure that we try to restore a greater sense of trust, well-being, and health in what proves to be our most important resource, human capital, our people. On that note, I'd like to take this opportunity to thank all of my panelists for joining us this afternoon. To Jennifer Lotito, President and COO of RED, Dr. Ida Buthia, who's a medical and scientific lead for Roche Diagnostics, Connie Mudenda, who is a RED ambassador and AIDS activist, as well as Professor Suleiman Akanmu, head of the Department of Hepatology and program lead for HIV at Lagos University Teaching Hospital. Thank you so much to each and every one of you for making the time to speak to us today. We managed through the technical gremlins to get this important message across, and we'd also like to thank you for joining us as our participants and guests for this specific webinar. As we continue to go about our ways, contributing to changing lives and of course beating the pandemics that are at hand on the continent, we'd like to wish you a safe journey as many of you embark on your initiatives. Keep safe and of course continue contributing to the health, well-being, and of course prosperity of Africa and its people. Thank you so much for joining us for this live webinar. From myself, Gugulethu Mfupi, and the team, it's goodbye for now.